Thousands of nurses now seem poised to walk off the job next month for the first time in nearly 3 decades after rejecting a new pay offer from the country's district health boards. The Nurses Union and DHBs will hold urgent mediation talks in an attempt to avoid strike action. But DHBs say there's no more money, and nurses say unsafe working conditions have taken a heavy toll on the profession and they've had enough. Nita Blake-Person has the details.
Today's rejection is the latest chapter in nearly a year's worth of nurses' pay and staffing disputes. Nurses say the situation has reached crisis level, and Karen Marshall from Christchurch is among those demanding action.
Because if we don't have nurses, even though we're facing industrial action on the 5th of July, if we don't have nurses, the public will be even more at risk than what they will be on the 5th of July whilst we're maintaining those essential services. So it's about being able to provide timely healthcare, and the time for that is now.
The DHB's latest offer included pay increases of between 9 and 15% to be rolled out over 15 to 18 months. It's nearly double the previous offer from DHBs in February and was worth more than $500 million. But Nurses Union spokeswoman C. Payne says the benefits aren't spread across all the union's 29,000 members.
Clearly, as we've said, there are variances in what this offer delivers across our membership. There are large parts of our membership that will not be receiving the 15.9, as we've calculated, percentage that a registered nurse on Step 5 might achieve through the settlement.
C. Payne says the union is now consulting with members about what their specific concerns are.
That's got a 3-day turnaround. We know that members will engage in that process with us. We'll be analysing all of that data. We hope to be in a much stronger position to be able to be clear about what will settle this dispute.
The survey received 2,500 responses in the first hour. But time is running out for mediation talks. The union will have to have the feedback collated this week to present to DHBs by Monday. A spokesperson for the DHBs, Helen Mason, says they will do everything they can to avoid strike action, but there's no more money available for negotiations.
It's a very good offer. It's actually an excellent offer. You're looking at $500 million. The offer that's currently on the table is $250 million higher than the last offer, so we've essentially doubled the offer with our latest offer, and there won't be more money on the table.
But Karen Marshall says nurses, regardless of their level of experience, don't feel the same way.
This offer was most attractive to the senior registered nursing group that have done more than 5 years of nursing, and they've rejected the offer. So you can see that it's not a solo effort. It is across everyone that have decided to take this action. So that is something.
It's been nearly 30 years since nurses took strike action, and if they do walk off the job next month, non-urgent surgeries and outpatient clinics are likely to be postponed. Helen Mason says DHBs are putting contingency plans in place, but essential services will continue and patient safety remains paramount.
We're likely to receive strike notice on the 20th of June, and DHBs are very well prepared to be advising patients and to be advising people who will be impacted as to any deferment of the or any delay to the treatment.
The two proposed 24-hour strikes are scheduled to take place on the 5th and 12th of July. Mō te hōtaka o te atanei, ko Nita Blake-Person, aho.